Today's episode is brought to you by One Electric, the experts empowering medical imaging centers. If you're setting up a new facility, you need an electric company that knows the ins and outs of medical equipment. That's where One Electric comes in. They specialize in reliable, high-quality installations, tailored specifically for MRI, CT, and X-ray machines. With One Electric, you can trust that your imaging center will be up and running smoothly from day one. Visit oneelectric.com to learn more. Welcome to A Couple of Rad Techs podcast, where we bring you an inside look at the world of radiology from the unique perspective of a married couple of radiologic technologists. Together, we have over 30 years of experience in the field and are here to demystify the science of medical imaging. Radiology is the unsung hero of the medical field, providing doctors with crucial images and information that help diagnose and treat illnesses. Join us as we explore the latest techniques, technologies, and innovations in radiology and discover the vital role we play in the healthcare industry. So come along for the ride as we share our passion for radiology as a married couple. Hello, everyone. I am Chaundria, and I am the host of A Couple of Rad Techs. And today, if you've never been to this podcast before or this channel before, we talk all things radiologic technology, medical imaging, X-ray, radiation therapy, and all of the above. And I have 22 years of experience in the field of radiology, and I'm here to share all the details with you. So let's get right into this episode. Listen up, future MRI techs. The demand for your skill is skyrocketing. Hospitals, clinics, outpatient imaging centers, they are crying out for top-notch talent. But here's the thing. It's not just about having the technical know-how and the certification. It's about being that kind of tech that the patients and colleagues, it's about being the kind of tech that the patients and your colleagues can't get enough of. Today, we're going to take a deep dive into the tips and tricks that will set you apart and launch your career into MRI stratosphere. Yeah. So let's get into it. We've got 5 tips here, 5 career tips for aspiring MRI technologists. So take your pen and paper out, tablets, whatever it is that you use, and let's get going. Enough talk. Career tip 1, focus on education and certification. I get a lot of questions in my DM. Should I have an associate? Should I have a bachelor's? I'm going to tell you. What matters is 2 things, your degree and your certification. You need to have both in order to get to that next level of MRI technologist. The first and foremost step is to get a solid education. Now, there are a lot of schools out there. I'm not going to be here to tell you which one to choose because I have never attended any of them. Yes, years ago, we didn't have any schools out there for MRI. We had to read a book, take our exams, get cross-trained at the hospital, and there was a little bit of didactic learning from some online courses, but it really was no different from me just reading the MRI practice book. I got a lot of helpful information from there, as well as the MRI review questions, this little yellow book that had tons of questions that reviewed you over and over and over to pass the registry. Eventually, there have become a lot of schools out there, some really expensive, some not so expensive. You've got to be the judge of where you're going to go to school for your education because you've got to get a solid education. This typically is going to involve an associate's degree in radiologic technology, followed by specialized training in MRI. That's one pathway. There's also a second pathway. That second pathway is you can actually have a degree already, go to a school that only teaches MRI. Now, that's important. You're not going to school for radiologic technology, which does limit you to strictly being an MRI technologist. Now, each of those schools is going to be different. They have different criteria for you to be accepted into their program. You're going to have to look at each program's criteria for acceptance and determine if you qualify. But there are schools out there. Also, you want to look at, are you going to graduate from that school with MRI being your primary pathway into medical imaging with the ability to sit for the ARRT certification or the ARRMRIT? There are 2 different certifications. One has been around longer than the other, and that's the ARRT. They have been around for many, many years and are the gold standard for many institutions. But ARRMRIT is one of the other options. Just know that some facilities and hospitals require the ARRT. So before you go on your educational journey into becoming an MRI technologist, make sure you do your due diligence and find out, is this school going to allow me to be able to sit for my ARRT or my ARMRIT? Whew, it's a mouthful. But those are your two options, primary pathway and post-secondary pathway. Two different options into it. In my opinion, I always encourage you to go for the option that gives you more options later on in life. Now, I'm not here to say one is better than the other. I'm just giving you the facts. One of them, you're going to go to school and you're only going to be able to do MRI, which is fine for many people. The other option is you get to do radiologic technology, and then you can go on to over 11 other modalities and specialties such as radiologist assistant. And I'm not talking about someone that turns over the rooms for the doctors. These are highly trained advanced practitioners that now have at least a master's degree of education, years of experience, and are able to do procedures that a radiologist is normally able to do, or a nurse practitioner or a physician's assistant. Yeah, people don't know we do those things. We do not just press buttons. That's why these tips for career growth for MRI technologists are just amazing. And you guys, MRI is really transitioning over into other modalities. CT and nuclear medicine cross paths all the time. Diagnostic radiology cross paths with so many other of our medical imaging professions. Well, MRI is crossing over radiation therapy in the operating room. Things are on the horizon. This is why these 5 career tips for aspiring MRI technologists is important. So keep your listening ears on. I hope this is helpful. Let me know in the comments, what other tips would you like me to tell you? But let's get on. Tip number 2, you want to develop technical skills. Now, this is really, really important because it depends on where you work. As an MRI technologist, you'll be working with complex equipment and software. It's not just equipment, it's not just people. There's different software, and mastering these tools is going to be critical and crucial. I know firsthand. I've got some stories for you. So stay tuned. If you're not following me already, I've got plenty other stories that's going to be coming up on my podcast about things you don't want to do because I've done them, and things you do want to do because I've done those too. 22 years of experience. I got some stuff for you. Developing your technical skills, that means understanding the anatomy and different body parts and being able to troubleshoot any technical issues that may arise. No, not may, will arise. I'm telling you guys, I remember when I first started out, I started out on a Philips Intera MRI scanner. Totally different from my next scanner. My next scanner was now the Philips was a 1.5 Tesla. The next one I went to is at an outpatient facility that did a lot of orthopedic work. And they were not even a 1 Tesla, a point magnet. And I had to get the same quality images that would happen on a 1.25 Tesla with dedicated coils and a more updated software. When I tell you developing your technical skills, it's a journey, but do that ahead of time. I kind of was thrown into the fire, didn't really have anyone to guide me. I learned a lot, yes, and it was a lot of trouble. I really tell you, now that they have educational programs out there, choose wisely. Choose ones that are going to give you great clinical education so you can go out into the field and feel way more confident than many of us felt back in the day. And the machines are so much stronger today than they were then. The highest that we worked on was a 1.25. I remember when 3 Teslas came out, very few hospitals had. And now you have more 3 Teslas out there that are commonly used. And again, you have more implants. Now, implants take a lot of research to make sure, because it's dependent on the patient, dependent on the implant, dependent on the manufacturer. And you've got to do your research first. Understanding the technical part of this job is very, very important, because depending on what implant they have, depending on basically the makeup, the anatomy, everybody's anatomy is not in the same place. And if you don't know where ligaments and tendons and, it can be a lot. But remember that each facility, it's going to take you time to get comfortable with the interface, with the scanner. Even if you're used to working on GE scanners, once you try to go to a mobile MRI GE, totally different software. You guys, totally, you might be an expert on that one GE over at the other facility you worked at, but when you go across the way, You can't run the protocols the same, even if it's the same scanner. Software may be different. So, with practice and patience, you will eventually master it. And it's okay if you move a little slower versus on another machine. The principles of MRI never change, even with a different scanner. Just remember that. Don't doubt yourself. Don't think you don't know what you're doing just because you move to another type of scanner or software. And don't hesitate to get another job at a facility because they have a scanner that you've never worked on. Use that as an opportunity to develop your technical skills even more. Ooh, we're making progress. Career tip number 3, patient communication is key. Communicating with your patients is going to make or break your day and make or break your job. Why do I say that? Because MRI exams are very stressful to some patients, especially those who are claustrophobic. That's why it's important to have excellent communication skills as an MRI technologist. You're going to work with different technologists that just are not empathetic or patient with the patients. Can't explain it. Some people just naturally are not. And some people are burnout and they don't know that they need to kind of go away and regroup and come back. But you can be different within your way of doing your MRI scanning. Learn how to patiently communicate and create a communication style with your patients. So that way, when it doesn't matter the patient and their anxiety level, you have a system that's set up that builds rapport with your patients to help them feel more comfortable and at ease before they ever get to your scanner. Work on what system am I going to use in order to have a close to 100% success rate, no matter what patient comes to my scanner. Are you setting up a new imaging center and need an electric company you can trust? Look no further than One Electric, your go-to partner for powering your facility. Here's why they are the best choice. First, One Electric understands the unique needs of medical imaging. They've worked with countless imaging centers, so they know exactly how to provide the reliable, high-quality electrical work your machines need to function flawlessly. Second, their team is highly trained and experienced in handling complex installations. Whether it's MRI, CT, or X-ray, they ensure everything is done right the first time, minimizing downtime and maximizing your efficiency. And third, One Electric is committed to customer satisfaction. They work closely with you from start to finish, providing personalized service and ongoing support to keep your center running smoothly. Choose One Electric for your new imaging center or existing imaging center and experience the difference expertise makes. Visit oneelectric.com today. And that's the number oneelectric.com today. That is the reputation you want to have. Not only does it make you feel good, the patient didn't waste their day. Your scanner is getting used, which means job security, which means productivity is increased, which means pay raises and bonuses if you get bonuses. The better the numbers look, the better for everyone, of course. And also making sure patients get the proper exams at the proper times. The more delay that you have, it's not good for patient outcome. People are coming to the hospital because they're in pain, they're sick. And being able to patiently communicate with your MRI patients is going to create an atmosphere that is really, really easy for you and makes your job a lot easier as well. And the procedure goes a lot smoother. I find that when I give calming techniques, I'll even tell my patients before we get started, taking 10 deep breaths, blow them out. And I just let them lay there and let them do that. I always offer an eye cover, earplugs, of course, and any kind of music. Sometimes some people may say, well, I'm not a DJ. I don't have time. We're behind. I don't have time for music. I'm going to tell you, I am mildly claustrophobic. And every time I get an MRI, I want music. I want music. I want something that relaxes me. This is not an option if your facility has. I feel like this is something that should be offered to patients. It has saved many scans and helped many people get through it. They can choose. Now, I don't act like the DJ with MRI scans. I do give people, I ask, what would you like to listen to? You can create whatever communication style you want. I just don't say what some technologists will say, I've got smooth jazz or elevated music on now. Is that okay? Or the music that you'll be listening to today is XYZ. And some patients will say, well, do you have hard rock? I don't tell people no if I have the music. I just say, make sure it's not music that's gonna move you, start you to moving on the table, because then we have a problem and I gotta turn the music off or change it because we can't have you moving. So I always explain to people your music choice is important as well. You do have a choice. And I feel like that calms them. Some facilities have herbal essential oils going in the room. Always having like a sheet or something. Nothing worse than being on an MRI scan table and freezing your butt off. I have had that happen to me and it was not comfortable at all. Like I was not happy during that scan at all. And yeah, that's all I'm going to say. Offer your patients, you may not be able to give them a warm blanket, of course, but you can give people a sheet and MRI and just monitor their body heat as long as they don't have a fever. Try to do things that will help the scan be successful, not just for your numbers and yourself, but also for patients. Here's career tip number 4. Stay organized and detail oriented in several things. How you bring your patients back, it's going to spill over into whether you are detailed and organized if you create a MRI safe environment. For instance, precision and attention to detail are essential in MRI, whether it's the type of scans, how you set your scans up, how you place your patient on the table before you even scan them. Positioning is very important, as well as detail to how you communicate, detail to how your room is set up. If your coils all over the place, if they're falling, breaking, things are kind of all over the place in your scan room, it kind of tells what kind of technologist you are. If I was a patient that walked in a room and it looked like a hurricane hit it, I would be a little concerned. Does this person know what they're doing? If they're fumbling trying to find coils because things are just not put together, that would be very off-putting for me if I'm already nervous about the scan. And if you're a kind of technologist that when you get back there, you don't have things kind of set up, be a little more detailed. You know where your paperwork is. Everything's in order. You don't have a bunch of papers all over the place, which could create a safety hazard where you got the wrong patient on the table and the wrong patient typed in. They don't match. You're doing the wrong exam. You didn't take time to have a system of before I bring the patient back, I look over the paperwork. I'm detailed in looking over the screening form, asking the patient the questions, winding the patient down, making sure they don't have anything on them, reconfirming with date of birth, armband, patient identity, as well as what body part, left or right, that we are doing. Doing consent forms to contrast, all of those things are done ahead. What is your system? How organized are you? When you scan your patients, are you waiting till the last minute to look at all the images once you've gone through all of them and you've already completed the scan? Okay, now I've been kicking back, talking on the phone, hanging with my friends, surfing social media. Oh, now I find out all 5 of my sequences have motion because you weren't detail oriented and organized enough to look through everything. Now the scan is an extra 20, 30 minutes. The next patient is behind. The department is not happy. I mean, there are certain things you can do to create and stay organized and be detail oriented. This is going to make your career in MRI just amazing and make you that go-to technologist. Final tip, career tip 5. We made it, you guys. I hope this has been helpful. Let's hit it really quick. Career tip 5, very important. Network and stay current in your field. I'm just going to say that. Networking is key to where your career goes. And that's in any profession. But our profession is very small in medical imaging. You always want to network. Never stay right in your small area. Branch out to other states, branch out to other countries. You have tools to be able to do that now. Networking is such a valuable skill for MRI technologists. You may say, how? You may not want to scan patients for the entire career of your MRI career. But if you never network, all you know is technologists that work right there with you in your area. You don't go to conferences. You don't have a LinkedIn profile. You're not active on social media into other people, even if you don't post on social media. Do you follow any people like myself who are active on social media? Do you follow our podcast? Do you comment on those in the comments? Do you share to your stories? Those are a way for those people to get to notice you and say, wow, okay, there's another technologist out there. Then I can network back. Get a conversation going. That's one thing I found, that never have an intention with networking. Your intention should be to add another person to your network. My intention with networking is not, ooh, maybe they can get me a job here. Maybe they can tell me how they are doing this, or maybe they could tell me how much they make. If that's your intention, that's not network. Networking is how can I support you? How can you support me? How can we work together? What's your next move? How can I encourage you? I've had this question about XYZ. I can't seem to get the scan right. How have you done it? Oh, thank you so much. Those are networking ways. Those are ways you can network. I encourage you all network, get out there and just send someone a DM in a profession that says, started following you. I just wanted to make a connection with a fellow medical imaging professional. I love your content or your bio. I've looked through your experience. Your experience looks phenomenal. And congratulations on all you've accomplished in the profession. I wish you many more years. Please let me know how I can support you. That's it. And periodically, you can send a message. Hey, just a year later or 6 months later, go into their post and comment on their post. That's networking. Go to conferences, go to different booths, introduce yourself. You never know. You might actually get from behind a scanner if that's been your goal, and get a teaching job, get an administrative job, move up into leadership, become an applications technologist, work in 3D. There are so many things that networking can open up for you. Connecting with other professionals in the field provides opportunities for growth and learning. Attend conferences, join professional organizations. Are you a part of the national organization, the ARRT? And this is not a plug for them. It's just our association as medical imaging professionals. You have nursing associations, very strong for nursing. They fight for nursing. They really give a lot of tools necessary to nurses, and nurses will join. Are we a part of the ARRT? I've been a member for a few years. My husband's always been a member since getting out of school. And that's something that he was like, oh, yeah, no, I'm always going to be a member. And I had to look back and say, well, why am I not a member? So I educated myself on what do these associations do for me? But then I had to say, why am I looking to get something out of it always? What can I get back? What can I give back? There are volunteer opportunities that will also further your career and advance you within the medical imaging profession, MRI, if that is your main profession, your primary pathway. But there, again, are opportunities to stay up to date with latest advancements in MRI technology through those avenues. And that's very important. If you're taking continuing education, I encourage you at least do an in-person conference once a year or every other year, instead of just doing the direct readings or the coloring book or just something at home. Try to do a webinar. Go somewhere live. That's going to be a way you can network. That's going to be a way that you can hear from other people what they're doing out there. Because there are some things happening in this field that if you don't network and move within circles, you're like left behind. And that is how I want to end this particular conversation, because this has been a wonderful conversation. I've really enjoyed it. Thank you all for being in attendance and being followers and subscribers. If you have not subscribed yet, please do so. A couple of rad techs. I'm Chaundria, 22-year veteran of medical imaging. In conclusion, becoming a successful MRI technologist requires a combination of education, technical skills, and excellent communication, organization, and commitment. By following these 5 tips, you'll be well on your way to fulfill your career in medical imaging, i.e. MRI. So if you have any questions or want to share your experiences in the field of MRI or medical imaging, please leave a comment and reach out to me on social media. You can find me at a couple of rad techs on all social media platforms. And don't forget to subscribe here. And if you want to know more about the field of radiology, check out one of these videos here. Don't forget to subscribe to our podcast as well, a couple of rad techs podcast, for more valuable insights and career advice. Thanks for listening. Until next time. And that's a wrap for this episode of A Couple of Rad Techs podcast. We hope you enjoyed our discussion of the fascinating world of radiology and learned something new about the role we play in the healthcare industry. If you have any questions or topics that you'd love for us to cover, feel free to reach out and let us know what they are. And you guys, please, if you enjoyed this podcast or any of the other episodes, we want to hear what you thought. Leave us a review. Mama's got to pay her bills. It helps. And until next time, stay tuned for more insightful and informative episodes of A Couple of Rad Techs podcast.